Back in 2011, I was dealing with jumper's knee. I was looking online for anything I could find on patellar tendon pain. I came across this one knee pain program where the basic idea was people who get knee pain jump with a knee dominant strategy. People with no knee pain jump with a hip dominant strategy. The program used examples of freak athletes who jump crazy high and who use more of a hip strategy than a knee strategy when they jump. The program is marketed not just for patellar tendon pain, but also for improved vertical jump. And the whole thing centered around the hips. The idea was to get you to jump with that more hip dominant strategy. So you're doing hundreds of reps of prone glute, bird dog, anything you could think of to activate the glutes. And then over time, it was progressing back into jumping, and your standing jumping was trying to be more of a hip dominant jump than a knee dominant jump. So I did this program for a couple months. I would spend hours doing glute activation and quad stretching, and I would progress back into jumping, trying to get the hip dominant jump. And at the end of it, I had no improvements in patellar tendon pain. It still hurt. So I think we can make a pro and con list for this type of approach. The positive is if you can actually get an athlete to use more hips, or at least strengthen their hips, they're going to take some load off the anterior chain and off the patellar tendon when they get back to sport. So having strong hips will be good. The cons are that a patellar tendon issue needs to be loaded. The quadriceps need to be loaded. If you completely take that load away, then an athlete gets back to sport. Those areas are going to be deconditioned, and they're probably still going to have pain. So what should you do in your own patellar tendon rehab? You want to get strong hips, but you don't want to neglect the knees. So let's take two exercises, the squat exercise and the hip hinge exercise. If you're doing a squat exercise, let's try to do that for more knee extension strength. So your torso will stay pretty upright, your knees will go forward a little bit, doing a high bar back squat, front squat, zercher squat, goblet squat, maybe elevating the heels. Those are all going to be easy ways to keep the torso upright and to get more knee extension strength. If you're doing a hip hinge exercise, we should try to do that for the glutes and the hamstrings, so your pelvis is just going to go straight back. So the squat is there to strengthen the knees, the hip hinge is there to strengthen the hips. You're not going to change the exercises very much. You're pretty much leaving them alone and letting them strengthen the areas they're meant to strengthen. And you should be aware of how individual athletes are going to compensate. If an athlete has patellar tendon pain, or they're more of a hip dominant athlete, as they get tired, as the weights get really heavy, they're going to shift more towards the hips. So you might have to deload the weight a little bit. You might have to cut the set a little bit earlier so that you make sure you're strengthening the knee extensors. And if you have an athlete who's crazy knee dominant and you want to strengthen the hips, they might still exhibit more of a knee dominant strategy when they're doing a hip hinge. If you're doing a trap bar deadlift for the hips and they just shoot the knees forward, maybe you coach them up to shoot the hips back more so they get more hip strength. So there's some things to keep in mind in your patellar tendon rehab. Try it out, enjoy.